Okay, it looks like we are at the top of the hour. Thank you everybody for tuning in. I'm just going to give it a couple minutes for people to keep joining. We are expecting a full house. But in the meantime, while we're waiting, I did just open a poll. If you could be willing to specify what type of agency you're with, we'd love to get an idea of who is joining us on the line today. My name is Michael Corey. I'm Program Specialist with the Opioid Operational Command Center. And I will get into everything in just a moment. Bear with us. Okay, well, I think we're good. So let's just get into it. For everybody on the line, I am about to hit the record button so that we can save this session and put it on our website for the people who could not attend. So just for your awareness, I'm going to hit it right now. And away we go. So today's session, Introduction to the Opioid Operational Command Center. Today's session is the second session of the same webinar, but this one is more designed for our local partners. So we hope to share information that you will find helpful at the local level, but it will hopefully be broadly applicable to everybody. Just a couple of housekeeping notes. Like I said, the recording is in progress, so we're great there. If you have any questions, please do use the chat box. And if you're looking for where to find it, it may look a little bit different. So try going to there's a menu bar across the top. You should be able to find chat box there. Or there's also at the bottom, right-hand side of your screen, there's a section that says participants polling. You should be able to find the chat box there. And I see some of you are already using it, so great. So I will try to monitor that as best I can if you have questions, but in the interest of time, I'd say while we're going through our presentations, if you can just put the questions in there and we'll try to get to them as time allows. For our agenda today, we will be going through the various different activities that our office engages in, beginning with an introduction from our Acting Executive Director, Robin Ricard, who will give you some information about the OOCC, when our office was founded, and some basic information about our mandate and what we do. Then after that, following Robin, we will go to Marianne Gibson, our State Partner Coordinator, who will talk about our work coordinating with various other state agencies, as well as with our department partners at MDH. Then following that, we will go to OIT Coordinator, that's a Opioid Intervention Team Coordinator, Teresa Heath, who will talk about our work engaging with partners at the local level. After that, we will go to Khalil Katir, our grants administrator, who will talk about the different grant programs that we have and the various grant performance reporting processes that we use to highlight the terrific work that all of our grantees engage in. And then we will bring it home with me, giving you some information about the different types of data that we collect and the reports that we distribute on a quarterly basis. So with that, I am going to happily stop talking now and hand it over to Robin for our introduction. Robin, take it away.
Good afternoon, everybody. Thank you so much for joining us today on our webinar. My name, as Michael told you, is Robin Ricard, and I am the Acting Director of the Opioid Operational Command Center. For those of you who may not have heard the news, former Executive Director Steve Hsu left the OOCC last month after accepting the role of Deputy Secretary of Healthcare Financing and Medicaid. This is very exciting news for him personally, but it's also very bittersweet for us. We've come a very long way under Steve's leadership, and his dedication and passion for the job will be sorely missed. However, we know firsthand that he'll do an amazing job at Medicaid, and we're excited to keep working with him in that capacity going forward. So with that said, the OOCC continues to soldier ahead with our work. We've had a lot of amazing projects planned for the summer and later this year, and we can't wait to share all of that with you. We'll be addressing many of the plans with you today throughout today's session. Let me just say, first off, welcome everyone, and thank you for tuning in. I know everybody's schedules are incredibly busy. For those of you who are familiar with the OOCC and just want to get additional information about what our office does, welcome. It's great to see all of you again, and a very warm welcome to all of those of you who have not heard of our office before. If this is your first time you've heard of the OOCC, we're very glad you joined us today so that we can all introduce ourselves. And we look forward to seeing what work we can all do together. So with that, let's get started. To kick us off, I want to give you all a quick rundown of the Opioid Operational Command Center, or as everybody calls us, the OOCC. I'll talk about how our office was formed and the fundamental components of our mission. So Maryland's response to the opioid crisis actually began in 2015 with the creation of the Opioid Task Force under the leadership of Lieutenant Governor Boyd Rutherford. The work of the task force resulted in a comprehensive list of 33 actions the state could take to implement a more coordinated response to an alarming increase in opioid-related fatalities, overdoses. Following those recommendations, in 2017, Governor Hogan declared a state of emergency related to the opioid crisis, making Maryland the first state in the nation to do so. He also issued an executive order establishing the OOCC. Our office was set up as an extension to the governor's office so that it could act as an interagency coordinating agency. And as I'll detail in a few moments, the basic components of our mandate are to prepare the interagency opioid coordination plan, to coordinate the efforts of all state agencies in each of the 24 local jurisdictions, and to review and approve opioid-related budget proposals and legislation. The OOCC was also charged with identifying gaps in local resources for substance use disorder, disseminating best practices, and coordinating state resources to fill those gaps. Next slide. In creating the OOCC, the governor laid out three major priorities, policy priorities to guide us in our work. They are prevention and education, enforcement and public safety, and treatment and recovery. Prevention and education programs include harm reduction, information campaigns, school programming. Enforcement and public safety related programs include traditional interdiction efforts, but much more, including diversion and jail-based treatment. And treatment and recovery programs include crisis services, peer specialists, and outpatient and residential treatment programs. The OOCC's functions as a hybrid organization. While we have been a member of the Maryland Department of Health since October of last year, we are, as I mentioned, also a part of the governor's office. Our office was established to serve as Maryland's chief coordinating body for the state's response to the opioid crisis. The OOCC works with all state agencies engaged in opioid-related programming so that we can eliminate red tape to the greatest extent possible. Thus, the OOCC's executive director wears two hats. Since our creation, the executive director served as a cabinet level official as part of the governor's office, and since joining the Maryland Department of Health as a peer of Maryland deputy secretaries. Something happened to the slide? Let me see. There it goes. We're back. From this position, the OOCC serves as Maryland's primary interagency coordinating office, working with various other state agencies. We also serve as the primary intra-agency coordination body for policies and programming designed to address the opioid crisis at the Maryland Department of Health. The executive director is also designated as primary spokesperson regarding the state's response efforts. And lastly, we are charged with reviewing all opioid-related budgetary spending. So the next slide, the executive order lays out the OOCC's mission in detail. As you can see on this slide, first, we're responsible for developing the state's annual strategic plan to guide Maryland's response efforts. We recently released our interagency opioid coordination plan of 2021, which we'll address later in today's session. Next, we're also charged with coordinating the state's response efforts at the state and local level. You'll hear more about these efforts later on from our state partner coordinator, Marianne Gibson, and our local opioid intervention team coordinator, Teresa Heath. Next, we collect, analyze, and facilitate the sharing of data relevant to the crisis, which we present in our quarterly reports. We also work with our state and local partners to facilitate the sharing of that data to the greatest extent possible. And as most of you already know, we meet regularly with OIT teams, or opioid intervention teams, and that's in each of Maryland's 24 jurisdictions. Been doing it virtually like everybody else the past year and a half, but hopefully we'll be back in person soon. We're tasked with coordinating training and providing resources for our state and local partners. We assist with the Interagency Heroin and Opioid Coordinating Council, or the IACC, which I'll address again in just a minute. And as mentioned previously, the OOCC is responsible for reviewing and approving all opioid-related spending. And finally, we review and provide input on all proposed opioid-related legislation as well. To put things in context, the graph on this slide illustrates the need to implement a coordinated statewide approach in response to the increasing rate of fatal opioid overdoses. As you can see, the opioid crisis continues to be in a state of emergency. 2020 was sadly the worst year on record for opioid-related fatalities in the state of Maryland, up 18.7% from 2019. This is nearly 5 times worse than where we stood a decade ago. And as we all know, the emergence of fentanyl has greatly intensified the problem since it came on the scene in massive scale in 2015. Last year, fentanyl was involved in 93% of all opioid-related deaths and 84% of all drug and alcohol-related deaths. As I mentioned earlier, the OOCC provides support to the Interagency Heroin and Opioid Coordination Council. The council is chaired by Lieutenant Governor Boyd Rutherford and includes multiple state agencies and provides opportunity to key partners to share pertinent information about the opioid crisis. The IACC meets quarterly and works to develop recommendations for policy, regulations, and legislation to reduce opioid-related mortality. The IACC is also a key partner that provides input in the development of our annual interagency opioid coordination plan. The council includes many different agencies: the Maryland Department of Health, State Police, Department of Public Safety and Corrections, Department of Juvenile Services, Institute for Emergency Medical Services System, State Department of Education, the Governor's Office of Crime Prevention, Youth and Victim Services, and other state agencies that is requested by the chair. And with that, I just want to thank everybody again for taking time to listen in on our webinar and all of your continued efforts. Now that the COVID numbers are going down, please let us know what you have going on. Reach out to Teresa Heath. We want to get back out there in person and see all of you in person again, and see all the great work that you have going on. You can also chat if there's anything up, put it in the chat box. That way everybody will know what is going on with your organization. And we want to put everything in our calendars. If we can get out there, we will. If we can get the Lieutenant Governor and the Governor out there, we will. So with that, thank you again, and I will turn it back over to Michael.
Thank you so much, Robin. for that introduction. And like Robin said, please do use the chat box. Just one last housekeeping note. WebEx does have like a Q&A box as well. Don't use that. That's kind of like the vestigial tail of WebEx, and it's not helpful for anybody. So please use the chat box. I will monitor that. I'll check the Q&A at the end just so we don't miss anything, but the chat box is definitely where you want to be. And with that, for the next portion of our presentation, I will hand it over to Marianne Gibson, State Partner Coordinator. Marianne.
Thank you, Michael, and good afternoon, everyone. For those who don't know me, I'm Marianne Gibson. I'm the Director of Planning and State Partner Coordinator with the OOCC. I'm going to quickly give you an overview of some of my roles and responsibilities with the office. Next slide, please. So beginning with the coordination plan. As was mentioned, our office leads efforts around developing the annual interagency coordination plan, which serves as the foundational document guiding the state's response to the overdose crisis. Our plan was developed with input from state and local partners and is organized by Governor Hogan's policy priorities of prevention and education, enforcement and public safety, and treatment and recovery. Our plan includes 9 overarching goals organized by 3 pillars. The prevention and education goals include preventing problematic opioid use, reducing opioid-related morbidity and mortality, and enhancing statewide systems to inform strategy. Enforcement and public safety goals are to reduce the illicit drug supply, expand treatment to individuals who are justice involved, and to provide alternatives to incarceration for people with substance use disorder. And to address treatment and recovery, we identified the goals of ensuring equitable access to evidence-based substance use treatment, enhancing the behavioral health workforce, and supporting the expansion of recovery services. And while these are the 9 overarching goals, they're supported by 30 accompanying strategies. In this year's plan, we included a new section which includes our office's priority projects. Those projects include developing a statewide infrastructure to respond to adverse childhood experiences, establishing a comprehensive crisis response system, providing wraparound services for individuals who are justice involved, expanding recovery housing, expanding care coordination for people who use drugs and who are seeking treatment, and utilizing data to inform programmatic decisions. And if anyone's interested in looking through the coordination plan, I'm happy to drop a link in the chat box. Next slide, please. So one of my primary roles is to facilitate coordination between various divisions and departments within the Maryland Department of Health and between MDH and other state departments who are working on opioid-related initiatives. So I'm just going to quickly provide a couple of examples of what that looks like in action. An example of intra-agency coordination would be some of our current work on the Data-Informed Overdose Risk Mitigation, or DORM initiative. We're pleased to be working very closely with our colleagues from the Behavioral Health Administration to advance this work. The DORM initiative came out of Chapter 211 legislation that was passed in 2018. And the purpose of this work is to link individual level data sets from opioid overdose decedents to develop relative risk profiles. We're really excited about this work, and we believe that the information gleaned from these profiles will help the state better understand who is at greatest risk for overdose and will help inform a more targeted resource allocation. Intra-agency coordination is a critical component of the DORM initiative and really requires us to partner very closely with multiple departments within MDH to better understand how to access and use their respective data sets. So the second piece of state partner coordination would be interagency coordination. An example of interagency coordination would be some of our work around our ACEs initiative. So our office observed that there were many efforts happening around the state to address ACEs, but there wasn't necessarily a comprehensive statewide strategy. And so to address this, our office engaged the National Governors Association to provide technical assistance to the state to help us develop an action plan to address ACEs across the lifespan. So to move this forward, we've engaged partners from various departments within the Maryland Department of Health, In addition to working collaboratively with the Governor's Office for Crime Prevention, Youth and Victim Services, the Department of Human Services, and the Department of Juvenile Services, just to name a few. As a coordinating office, we're enabled to bring partners together who are working on projects with similar goals and scopes of work to improve efficiencies and leverage resources. And we're really pleased this ESA's initiative has been very successful, and an outcome of that work has been an executive order that the governor signed last month to declare Maryland a trauma-informed aware state and to declare May 6th as ACE Awareness Day. So that is really exciting, and we're really grateful to have had a role in that work. So in addition to liaising between state partners in our office, I also participate in opioid-related grant reviews and work groups and lead our opioid-related special projects. So if anyone ever has a question about a statewide initiative, please feel free to reach out to our office for more information. And with that, I will turn it back over to Michael.
Great, thank you so much. And the rain is starting to come down here in Howard County, so if you can hear the thunder in the background, please do forgive me. It's a little dreary out there, so hope you all are staying dry. For the next portion of our webinar, we are going to turn it over to OIT Coordinator Teresa Heath. Teresa, take it away.
Thanks, Michael. Good afternoon, everyone. My name's Teresa. I'm the Opioid Intervention Team Coordinator with the OOCC. My role is to serve as the liaison between the OITs in each local jurisdiction and the Governor's Office. I'm going to give you a quick overview of the history and some of the function of the OITs. Next slide, please, Michael. The executive order mentioned earlier included a requirement that each of Maryland's 23 counties and Baltimore City develop an opioid intervention team, or as we call them, OIT. The executive order that created the OOCC and the OITs also provided an outline of which agencies were required to participate in the OIT in order for the jurisdictions to receive OOCC grant funding. Those required partners include emergency management, the local health department, law enforcement, social services, education, and community organizations. Next slide, please. There are additional agencies and partners that we at the OOCC believe are important to engage in the OIT, and those include corrections, parole and probation, EMS, State's Attorney's Office and Office of the Public Defender, local hospitals, and the others listed below. Next, Michael. So OITs are multi-agency coordinating bodies located within each jurisdiction that coordinate the local response and programming for the opioid and overdose crisis. The OITs are chaired by the local health officer and emergency manager and are expected to meet regularly at least once every other month. It's also important that each OIT develop a local strategic plan to address the opioid crisis that focuses on the needs in their local community. These plans, we recommend, they should be updated about every 12 to 18 months. OITs work to identify and fill programmatic gaps through collaboration and the use of OIT grant funds, which Khalil will talk about a little bit later. We also encourage OITs to share additional funding opportunities outside of our grants with one another, just to be sure that we're leveraging all available funding sources, because we all know we can never have enough money. OIT alerts are another way that we communicate with the local jurisdictions. They're sent as needed to share information about events, webinars, resources, and other announcements. One recent example of an OIT alert that we sent out was about a substance called xylazine. We sent this out in response to the increased presence around the state in the drug supply, and it included a toolkit which was designed to provide information to the general public, as well as specific information for behavioral health and medical providers. Next slide, and I think this is where the poll is. Yeah.
Okay, great. This will be a test of my poll making abilities on the fly, so hopefully this works. I unfortunately didn't get a chance to review the results from the previous poll, so this will be kind of a interesting test of where we're at. We can give people just a minute or two to fill this out.
Sure. So the quick poll question is, do you know how to contact your local OIT representative?
Question for you guys. Can you see the results as they're coming in? Oh, okay. Well, they are coming in.
I do not.
I think once I close the poll, then you all should be able to see the answers. And it looks like we've got a decent amount of people who have participated. So 11 of you have not answered, but I think that's an answer in and of itself. So, okay, I am going to close the poll with that in 3, 2, 1. And can you see the results now? Okay, I will just read them to you. So 21 of our participants today said yes, they knew how to contact their OIT representatives. And 16 did not. So it's a good thing we're doing this webinar for the 16 of you who do not. And if you want to learn how to do that, you can talk to Teresa.
Thanks, Michael. Yeah, 50%, that's really good. I was expecting a lower number, but that's great. For anyone who doesn't currently know how to contact their local OIT and would like to, you can reach out to me directly. I think as a follow-up to this webinar, Michael will send an email with all of the materials in addition to all of the contact information for our staff. Next slide, please. Central to our work is gathering information and sharing best practices with our local partners. In a moment, I'll show you a snapshot of our OIT Program Inventory. This is how we keep track of what's happening around the state with regards to opioid programming. Each quarter, we ask the OITs to fill out a survey and self-report to what degree they have implemented the programs that are listed in the inventory. And currently, we have around 143 programs and practices being surveyed. Next slide, Michael. Okay, so this is just the first page of the inventory to give you an idea of how it's laid out. You can see a few of the sections here, but in total, there are 12 sections, including public health, behavioral health, judiciary and state's attorney, corrections, parole and probation, emergency medical services, police and sheriff's office, social services, hospitals, education, higher education, and OIT programming, which addresses mostly the structure of the OITs. The dark green boxes that you see mean that the jurisdiction has substantial programming in place. Light green means that they have some programming in place for that particular program, but they believe there's room for improvement because these are all self-reported. Yellow means that the program is in development, and red means that there's no programming in place and none being planned at this time. Each year, our office does local OIT leadership meetings where we meet with the leadership team for each jurisdiction, and we review this survey. And although we know that not every single program on here will work or is a right fit for every jurisdiction, we take time to walk through the survey and talk through any barriers so that we can offer our support for programs that the jurisdiction would like to implement but are having challenges with. These OIT survey results are included in each of our quarterly reports, which are released publicly and uploaded onto our website under the Resources tab. So you can actually go on our website and see, I'm not sure how many quarters we have on there currently, but at least the last few quarters. So you could go on and look and see what your jurisdiction has reported for the last few quarters. And that is actually the end of the OIT portion of the webinar. And next, I think we'll hear more about grant funding.
We will, but before we transition, Teresa, there was a question that came in from Ann Simpers. She asks, how do you receive an OIT alert?
It's a great question, Anne. We have a contact list where these alerts are sent to. So I think that's something that you could reply to Michael's email after he sends the follow-up email to the webinar and let us know that that's something that you're interested in. That would be helpful. Just provide your email address.
Yeah, absolutely. And we will make sure to include you on all alerts going forward. And with that, I'll hand it over to Khalil to talk about our grants programs. Khalil, over to you.
Hello. A lot of familiar names there on the participant list. Hi, Anne. Good to see you. I'm the Grants Program Administrator for the OOCC. I'm here to tell you a little bit about our grants programs. Next slide, please. Okay, so I administer two grant programs. One is the Block Grant Program, which is familiar to all the OITs. It's a base level of funding to each jurisdiction in the state out of $4 million. This is consistent between FY19, 20, 21, and soon 22. The funding are generally directed by the local OIT and how it's going to be used. And it's also allocated based on a formula that integrates fatality data that we get from the Department of Health. The funding is required to be used in alignment with the Interagency Opioid Coordination Plan. But generally, it's up to the discretion of the OIT. The competitive grant program is a competitive application, of course, that distributes funding across the state. In FY21, that's going to be $5.6 million. It will be approximately this much for FY22. I'm sure some of the participants right now are looking for an answer on how our FY22 review process is going, and I can say that it's certainly going. This is available to state and local governments and community-based partners. It's also scored, each application is scored by a committee of, I believe, 9 to 12 people on the same set of criteria over each application. This is also required to align with the Interagency Coordination Plan. Next slide, please. So these are the funding amounts that we have for FY21. This generally follows, as you can see, impact, which is measured again by opioid fatalities. So you're going to see higher levels of funding that are allocated by the dark blue amounts, which is that block grant allocation to areas such as Baltimore City and Anne Arundel County, because they have a higher impact, they have a higher rate of mortality, higher fatality numbers. The competitive allocation is awarded, again, by committee and scored by criteria. So this doesn't necessarily follow the funding allocation by formula and fatality statistics. However, jurisdictional equity is taken into account when they are scored for impact. Next slide, please. In FY21, this was the general funding split for all of the awards, all of the programs that were awarded, including the block grant and competitive grant awards. Majority of the funding, 60%, were for programs that included treatment and recovery, 33% for prevention and education, and 6.5% for enforcement and public safety. I must correct myself. This is the funding split for FY20, not FY21. Next slide, please. We have a grant performance report. Every quarter, the OOCC is required to report on the use of the opioid crisis funds. This primarily involves the performance of programs that receive funding through our grants programs. So quarterly, when grantees report on how their grant is doing by performance measures that they identified in their applications, this we then review, analyze, synthesize, and put out to a report called the JCR report, which is going to be submitted to the General Assembly, the Senate Budget and Taxation Committee, and House Appropriations Committee. Next slide, please. We have done quite a lot, and by we, I mean the grantees that we have funded with the opioid crisis funds throughout the years. This is just for fiscal year 20. Over 20 different PSA campaigns, millions of impressions, 2,300 awareness or training events across the state, not just localized in one area. An enormous amount of individuals trained in naloxone administration. This is both in-person and virtual trainings. We have increased the access for Marylanders with substance misuse disorder to treatment and recovery services. We have expanded the expert in schools and local communities. We've also done a lot with mobile crisis services, including purchase and outfitting of vehicles, funding staff to work those vehicles and get around the state and deliver services. We also have a pretty good number of youth prevention programs and a lot of impact with students across the state. Notably, I'm thinking of Worcester County and Cecil County comes to the top of the mind, but certainly throughout the state, we have a lot of impact there. Next slide, please. Okay, so this is a question for both the OITs and for any applicants for the competitive grant program. Want to know what kind of grant opportunities is a poll question would you like to see the OOCC? I appear to have muted myself, but you get the picture. What kind of things do you want to see the OOCC support in the future when it comes to grants? And Michael, if you'll put that in the poll, I guess I'll open the poll here and see if it's going.
Yeah, so for this one, I think since this is kind of like our essay question portion of the exam, if everybody could use the chat box, Khalil and I can sort through that and sort of address them as they come in, but we can give people just a couple minutes to submit some answers.
That's right, thank you.
And while people are submitting their answers, and please people don't be shy, we'd love to get your feedback. We greatly value your input. But if you want an idea of other programs that we have funded in the past and you're not familiar with them, you can find some resources on our websites. There is a press release that we issued when we announced our FY21 awards last year, and you can sort through that and kind of see the different types of projects that we awarded and by jurisdiction and type. It looks like we did get one in.
Just some additional information here for FY21. Like we said earlier, there were $5.5 million in projects that were awarded. We have an enormous amount, let's see, 11 different projects that were statewide, that had statewide impact or multi-jurisdictional impact, totaling $1.8 million. There were a lot of projects that fell into one county or impacted only one county, just based on how they were localized, where the work was being done. But a few of our projects had a much broader impact that spread all the way across the state. Okay, so it looks like we're looking for child care needs. Okay. For TXT, is that via text? Maritrice, can you help me with that? Expansion of peer services and workforce expansion retention. That's certainly that's definitely a very high priority. As Marianne can tell us, it's very high up in our interagency coordination plan. Expanding peer services through training, train the trainer programs. That's right up there. That's very much a part of our grant funding. Funding to help individuals pay for rent and recovery housing. We have that as well. These are things that I've either seen in past grants that we've made or in applications that we have coming up. So that's certainly something that we have. Transportation needs, thank you, Anne. Rural areas, yes. I'm trying to think, I know we have a few right now that have transportation support for people to get to and from services, but I can't think of the name or location of the project right off the top of my head. Substance use disorders and OID. That's a good question. So Sandy mentioned perhaps expanding to include all substance use disorders and not only opioid misuse disorders. That's something that we will have to look at moving forward, because the impact of OUD doesn't necessarily stop with just an opioid. And right now we have to look at how impacts from lead substance or impacts from ACEs affect the opioid misuse disorder, and how that, then ripples backwards, and where we fit in as a funding body there. Those are all really good mentions. I can say for sure that some of those things are absolutely part of our grant funding initiatives. Those are definitely things that we're looking for when the scoring committee is looking over projects. And then, yeah, there's absolutely opportunity for growth there as well in the expansion. I see more. Financial support and recovery county, yep. Okay, Matrice, you said treatment, job training, absolutely. Expanded use of safe stations. When we're talking about expanded use of safe stations, what do you mean? Is that implementation of more and more locations, or can you give me more information on that? More locations. Okay, I see. Yeah, certainly. And we definitely have expanded staffing, and I'm sure that there is implementation there for additional locations. Focus on grant support for OUD only. That's something that we'll have to look at. It's not my decision to make right now. But yeah, these are absolutely something to look into.
Yeah, these are. Okay, I was having trouble, obviously. Yeah, these are wonderful responses. We do sincerely appreciate them. We're going to write them all down, and we're probably going to tally them. And like I say, we are, what we do is, it's fluid. It's a living and breathing thing. And just like the opioid crisis is a living and breathing thing and constantly changing. So the more that we can, stay tapped into what you guys are seeing on the ground level, the more nimble we can be in calibrating our response efforts at the state level, and, helping to coordinate response efforts at the local level too. So thank you all for submitting these. There was one question that I think was really pertinent for right now, and then a comment or two. One question is, who is eligible to apply for an OOCC grant?
That's a great question. So the eligibility is for state community partners, nonprofit partners, and for-profit partners. The key part there is to have the support and collaboration, unification with the local health departments, if we're looking at applying for a competitive grant, which is what we're looking for. Those four things are the key when talking about who is able to apply for funding.
Awesome. Well, thank you very much, Khalil, for that information. That was great. In the interest, I know there's a couple of other questions. In the interest of time, we're just going to segue to the next portion, knock that out, and then we will come back to Q&A just so we can check all of our boxes. And the next portion of our presentation just happens to be me. My name is Michael Horry, Program Specialist with the OOCC. And to bring us home, I will tell you all about the data monitoring efforts that we engage in, and some of the reporting that we put out on a regular or semi-regular basis. So getting into it. So we track and analyze a wide variety of different data sources in our work, with kind of the goal of just, answering the question, just like, what is the current status of the opioid crisis today? Where is it going? And what sort of metrics can we use to sort of assess that and, put a number on it, for lack of a better words. When we do this with a wide variety of information, a wide variety of data sources that we rely on our partners heavily for, because the OOCC itself doesn't really own any of the data, but we are serving a sort of like a facilitator role of, putting all this data in one place, compiling it in a report and, making it available for people. So some of the types of data that we look at start with fatalities data, which we get from the Vital Statistics Administration by way of the Office of the Chief Medical Examiner. And that's obviously one of the chief metrics that we are looking at on a constant basis, just to see sort of the broader direction of where the opioid crisis is going. We work also with the Behavioral Health Administration. We've done a lot of analysis with them to look at, say, to dive a little deeper into that data, to do an assessment, say, of like demographic trends, looking at race, age, gender, and we've partnered with them to include some of those analyses in our reports more recently. They've also provided us with a lot of information about engagement in the public behavioral health system. So we can see sort of the trends of usage of that system over time. And this is kind of, actually, no, I'll save it for later because it's the coolest part. Moving on, we also look at HSCRC data and CRISP by way of CRISP, and also Essence data, which is a database maintained by the Maryland Department of Health to track overdose events in hospitals, and that's specifically non-fatal overdose events, because you know, it gives us a broader picture of what we're looking at. Another source of non-fatal overdose data is MIMS, Maryland Institute of Emergency Medical Services Systems, I believe is what it is. Please correct me, anybody at the OOCC, if I mangled that. But they also track naloxone administrations by EMS personnel. So we're getting kind of like, as best we can, trying to get a scope of how overdoses with fatal and non-fatal are changing over time. So, you know, a non-fatal overdose, they might receive naloxone from EMS technician at their home, and they might not necessarily go to the hospital, or vice versa. They might, you know, go directly to the hospital or be transported by a friend or a community organization. They might not encounter EMS in the field. And then there are a wide variety of other data sources that we look at, and probably too many to name now. We look at, you know, treatment trends by way of like I'm forgetting the acronym, but TEDS, I think it's like the Treatment Encounter something or other database, where we can look at the number of people entering treatment over time. We can look at people who utilize Medicaid services, and we also look at trends in the PDMP and looking at prescription opioid prescriptions over time, looking at like full metrics such as like morphine milligram equivalents, and seeing how like the total strength of prescription drugs being dispensed to patients in Maryland is fluctuating. And there's actually some really encouraging trends where that is trending down. And the really cool thing that I mentioned earlier is some of the cool work that the OOCC is doing currently, that Marianne actually talked about earlier, is looking at how some of these data sets can be linked together and some of the insights that we can glean from that. And a lot of our partners are doing some amazing work with this and have been for the last several years. So say linking Medicaid data with death records to get a sense of like what types of services are more, you know, closely associated with people who are suffering a fatal overdose. So that's in a nutshell. And it's probably a disservice to talk about all these different things very quickly. But if you're interested in learning more about it, you can check out our quarterly reports and our annual reports. Our annual report does contain a little bit more information from our state partners, and contains a whole host of different metrics that you can check out. And if you're interested in reading those reports, you can check out our website, and I will drop a link to that in the chat box. And I think I'll leave it there for the reporting. I did see a question come in the chat box. Will you use Optum data for the PBHS utilization? That's coming from Howard Ashkins. And Howard, I don't know. That is beyond my technical capabilities. I think Marianne, I don't know, can you speak to that quickly?
Sure, yes. The plan is to look at Optum data for future dorm reports. So we do have some public behavioral health system utilization for previous years, but moving forward, we do hope to use Optum data for future dorm reports.
Fantastic. And then just to wrap us up, one of the cool initiatives that we're working on with these data sources is trying to visualize it in ways that we do in our reports, but making it more accessible. And one of the things that we're working on now is creating a OOCC opioid data dashboard to bring some of those things to life and to share it with all of you on a more timely basis. So you can see a snippet of it here. I was going to do a live demonstration of it, but I am going to forego that because I haven't tested it on this platform and I am scared that it's going to crash my computer because it's prone to do that. But you can kind of see how it looks here. We've got a map. There are interactive features. So for example, you can click on one of these counties and see some recent metrics such as recent overdose trends. What this map in particular is telling you, this is data from 2020 showing overdose deaths and how they changed from 2019. So there's some regional trends there. We have various other charts that are simple, easy to use, pretty straightforward. We intentionally want it to be simple and straightforward, so you don't need like instructions to know how to use it. And also so that it's a little bit more like technologically friendly and can work across a wide variety of devices. So we are hoping to get this added to our website. At this point, it's probably going to be after the release of our Q1 report. But we would certainly love your feedback. So another thing I'll drop in the chat box in a quick second is a link you can use to be our beta testers if you would be willing to check it out. And let us know what you think of it and if there's any information you'd like that you would like to see added to it in the future. And I'll just end by saying that this is kind of it's kind of like the first step of what we're trying to do. There's a lot of different offices at MDH who are working on similar projects, and kind of like our promised land is to create sort of like a unified space where we can put, both opioid related and other types of drug or treatment related information available to the general public in an easy to use format. And this is kind of the OOCC's like first initial contribution to doing that. So that's a long way of saying that this is like, we're starting simple, but we intend to add to it as we go. So for example, one of the things we hope to do in the more near future is to start adding more demographic information about opioid overdose decedents. So you can look at some of the information that's in our report, such as, race, ethnicity breakouts, gender, age, and all that. And one of the questions we got the last time we did this presentation was, how is this different from the CRISP dashboard, which does present a lot of the same information? Well, the difference is that this is public facing. And anybody can access it versus needing, to be with like a state agency or something like that. But the drawback to that is that it is also on a time lag and sort of correlates with the release of our quarterly reports. But that's in a nutshell. Looks like we have just a few minutes left, so I'm going to end my portion of the presentation here. Oh. Lost the we're going to leave it here. This is our contact information. Please do reach out to us with any questions that you ever have, especially any of the very talented and passionate people who work at the OOCC. Any and all of us will be more than happy to answer any additional questions that you have. So with that, I think we can revisit our chat box and see if anybody else has any questions. And being a little risky here, if you are feeling particularly bold, do feel free to unmute yourself. We'd love to hear your voices, sure, but also do use the chat box and we will try to field your questions as we go. And just ending, contact information slide is missing. Well, I hope you can see it now. I hope I'm sharing my screen. You can email us at help.oocc@maryland.gov. Oh, it's not showing up. Oh no.
Yeah,
Help me.
something happened to the screen. It's now like grayed out.
Oh, good grief.
It was
Uh,
there and then it disappeared.
Let me try it one more time. Hijinks, technology.
There you
There
go.
we go.
Yeah.
All right.
And Michael, I
Okay,
just
so-
wanted to thank everybody one more time. Everybody on this call, the reason why you're on this call is because you chose this profession, and you chose this profession for one thing, to save lives. So please, reach out to us. We're here to help. We're going to continue to fight this fight together, and try to take care of yourselves, because you're superheroes and you can't take care of the world and save the world if you're exhausted. So please get some refresh time. And thank you again.
I'd
Yes.
like to thank
Amen.
your team for supporting our projects that we've had for the 2020 and 2021, and hopefully 2022, just putting that plug in there. But thank you for all your support for our projects.
Hi, Ann. Yeah, I appreciate that. Midshore Behavioral Health, right?
Yes.
You got it.
Awesome. Yeah. So we've got 4 minutes left. I'm just going to go sort of chronologically backwards through this chat box because that's the easiest thing for me to do. I'm just going to go through here and make sure we hit on everything. Where can I find information on applying to these grants? What department and what and contact information, asks the punter.
That's a good question. I think I can speak to that one. When we have the award notification, let's talk about the competitive grant program first. When we have the award notification for the competitive grant program, this year it went out in March, and I believe, so that's March FY21. It was also March FY20. For FY22, it will probably be about the same, but we put a bulletin on our website. The governor also does a press release, and we push this information to OITs themselves, who can then disseminate it to their community partners. We also have another list that we push out to for other folks like yourself who have asked to be added to the contact list for this purpose.
Great, that's perfect. Yeah. And let's see, going backwards, I did see one comment from Howard Ashkins who says, I feel that the OOCC should focus on grant support for OUD only and not other SUDs. And I think, Khalil, you had engaged with him, so I don't know if you answered his question or if anybody else from the OOCC would be willing to speak to that.
We talked briefly about that topic. It's not something that I can really speak to right now on how grant funding will be used outside of what we're directed to use it for under the executive order. It's a little too deep for this format. Sorry to say.
And I'm okay with that. Thank you.
Yeah, but it's honestly something we constantly need to be thinking about, and it is something we're constantly thinking about. We have these discussions, pretty often. So it's good to hear everybody on this session's feedback, no matter what. So, and I actually didn't see any other questions. So, if anybody else does have a question, do feel free to throw it in the chat box real quick while I vamp and talk to fill time. But with that, I think we're kind of at a natural closing point. We are at, close to the top of the hour. So to reiterate what Robin Ricard said, thank you everybody for joining us today. We do not currently have another webinar scheduled, but we are planning them as we go. We're going to have a very busy summer, and we're going to be sending you lots of exciting stuff. Webinar-wise, however, I think our next goal is to do something about mobile crisis teams. While we don't have a date for that, we are soliciting participation. this is like it's a really important topic right now, we think, and we'd love to kind of share models of what is working. So that's kind of most immediate on our radar. And then just a selfish pitch from me. If you have ideas for webinars that or pertinent topics that you'd love to hear about, do send them to me. We're trying to get information out to our partners as often as we can. So if there's something you'd like to hear from us or something you'd like us to coordinate, let us know. But yeah, no, thank you everybody for joining. Thank you to all of our panelists, and we will leave it there.
Michael, before you go, did you want to put the link to the data dashboard in the chat?
Yeah, absolutely.
Give our folks a chance to press some buttons in there.
Yeah, I'm so happy you did not let me close the webinar without doing that. Just threw it in the chat. That's actually a Google form that you can fill out and evaluate and give your honest to goodness feedback about anything and everything. If you think it looks pretty or you think it looks ugly or whatever, we will happily accept anything and everything that you're willing to share or contribute. So you can use that link there. It should be accessible to everybody. Marianne, I'm not sure if you added the coordination plan to the chat box, but I have it here.
If you have it handy, please feel free to drop it in. I did not share the link, so thank you.
I have it right there. Thank you so much, Khalil. You are a lifesaver. I'll just give people like 2 seconds to copy those links, but with that, I think we'll conclude. Thank you all so much.
Thank you. Take care.
Thank you, everyone.